Okay, today we're going to do the pre-course work for week 3 of the Health Psychology SSC. And we're going to be talking about what you're going to be doing next week, which is interviewing a patient and listening to a patient's story as well. Now, this is actually part of a field called narrative medicine, which is an approach to healthcare that is goes above and beyond the sort of normal kind of clinical encounter, where you're trying to listen to the patient's story, thinking about um, what they say uh, about their healthcare journey, and kind of recognizing and absorbing the patient's story. The idea is that it hopefully helps to produce kind of clinical empathy, and that it helps you as a practitioner understand the complex presentation of an illness, uh, which is, I guess, the patient story, alongside the sort of the disease side of it, and the disease side of thinking, which I guess is the doctor's story. Um, it also kind of validates the patient's experience by treating their story as not just a sort of subjective account and something that isn't really relevant to the actual disease, but something that's actually core to the whole process of acknowledging of what it's like to live with an illness. Um, Hopefully you'll find this will enhance your communication skills, because it will allow you to use things like attentive listening, and um, really kind of help you to understand the sort of the metaphors and the language used by the patient as really being a sort of window into their feelings about what it's been like to live with this illness. So, what's going to happen? You're going to meet a real patient, so it's not a simulated case. We have various patients who are going to come in, and they're going to tell you a bit about their story. It's not an exam, it's not an OSCE, it's not an assessment. Um, so you'll be with another student colleague, and I'll be going in and out of the rooms, but I won't be assessing you in this process. And the goal is to kind of understand the lived experience of the patient. You're not there to diagnose. You're not there to treat. Um, you're there to gain from their experience and their life story. What this session isn't. It's not about getting the right answers. So, and again, you're not there to diagnose. You're not there to figure out um, what the correct interpretation is of the patient's story. You're not there to judge and evaluate. You're also not there to fix problems. So you're not there to uh, use your clinical knowledge and use your medical knowledge to diagnose the patient. You're not even there to really show your clinical knowledge at all. Uh, you're not there to um, really use your medical hat in the room. You can leave that to one side. It's about trying to listen to the patient, and therefore it's not really about being efficient either with time. You've got a good bit of time for this, talking to this patient. This might be, unfortunately, the only time in your medical career where you're not time pressured. You'll see patients as you go in clinics, in hospitals, in outpatient ward and outpatient clinics, and as you do that, you'll find that you've got a very short amount of time to spend with each patient, sometimes less than 5 minutes. That's not what this is about. So you've got a long stretch of time to listen to this patient and to ask them questions. Questioning is one of the big things that the session is going to be about, but it's not about you trying to hurry the patient or to um, uh, really think about how long this is. You've got enough time to spend with the patient. So what you will be doing is you'll be letting the patient tell their story in their own words, telling you about um, how they felt about their illness, telling you about where it started, telling you about the process that they've been through, telling you what their life is like now. They decide what to talk about. So it's up to the patient to really decide that. They decide how much detail that they want to share. They decide where the boundaries are. So when you're questioning, you can ask things that are appropriate. You can ask things that are wise. But if you sense a boundary, if you sense the patient doesn't want to go in a certain area, then that's okay. The patient's entirely at their own discretion to do that or not. Your initial job is to listen, to sit and to listen to the patient. Active listening is a big part of that. You can also do reflective listening. Reflective listening can be when you summarize what the patient has said. So to show that you've actually listened, and also to force yourself to listen. It's where you can stop after they have spoken and say, okay, so let me see if I've got this right. 10 years ago, you were experiencing X and Y symptoms. You went to your doctor and you found that the doctor was or wasn't helpful. You then, whatever, and you can then show that you've actually listened to their story. So don't interrupt them. Obviously, you can reflectively listen when there's gaps, when there's pauses, when it's appropriate to do so. But it's not about you, again, this idea about rushing the patient. It's not about that. You can ask open and respectful questions. So we will work a little bit after this presentation. We'll work a little bit on how those questions might be developed, what you might ask. But the questions that you go into the session with are by no means an exclusive list. It's just to give you a bit of guidance as to what you can use when you're in there. You'll also follow what matters to the patient. So when you're questioning, it may be that you've got questions about the medical side of it. You've got questions about what exactly symptoms were seen, and how that was used to come to diagnosis. Now that might not be something that matters to the patient. What might matter to the patient is the way that the treatment affected their relationships with their family members, for example, or it may be that the inability to work caused by the illness was the thing that really matters to them. So notice what's going on with them. Notice their emotional cues and use your question to follow that through. What you won't do is offer advice. So again, in this situation, you're not the medical expert, and there's no role for you in this to be offering medical advice. Also, you won't be offering reassurance reflectively. So if patients are worried about their long-term prognosis or their long-term life, saying things like, I'm sure it'll be all right. That's not the kind of thing that you're doing either, because you don't necessarily know that it will be all right for the patients. And you're also not jumping to solutions. You're also not going straight in there with, oh, have you thought about this treatment? Have you thought about this treatment? Or have you tried this? So those are the things that will not be part of this. So in some ways, it's quite different from what you're maybe used to. It's also different from, say, taking a medical history, although this is maybe the closest thing that you've came to in the past dealing with this. Clinical history has the structure to it. It's very focused on driving the agenda of looking for certain symptoms and looking for certain issues and problems that may or may not indicate particular disease presentation. That's not what you're doing here. Clinical history is also very agenda driven, very time efficient, and very disease focused. None of that is going to be particularly relevant just now. What you're going to be doing instead is a patient interview. So think of it more like a kind of interview that you would see on, say, a podcast, or that you would read in a magazine where somebody's telling their life experience about a particular thing. Think of yourself as the host, where you're allowing them time, and you're allowing them to really explain their experiences, and it's really being led by them. You can offer some ideas, you can offer some structure, but it's being led by what they really want to tell you. Okay, so after this, then you'll get a chance to ask questions. Right, so once the patient's told you the story, you'll get a chance to ask questions. Good way to think about questions is to kind of have questions that are open. So phrases like, can you tell me about what it was like when you were diagnosed? Can you tell me about what the treatment was like? Can you tell me about how you felt? Can you tell me about what your work situation was like? Can you tell me about how your family reacted? Can you tell me about what it was like when you left the hospital? Whatever those kind of questions would be. You can also invite reflection. So things like questions like, what was that like for you? Whenever the patient says that they were diagnosed or they had to go in for radiotherapy, or when a healthcare practitioner told them a certain thing. Also follow emotion. So listen for emotional words and phrases. Emotions are usually one word that describe a person's internal state. So emotions are things like frustration, anger, happiness, sadness, fear, worried, afraid, concerned, joyful, thankful. All these are words that are emotion, and they can be useful kind of hints that there's something to be explored there. So patient, could say that they're frustrated at a certain point. You can say, you mentioned that you were frustrated when your symptoms were undiagnosed. Can you tell me a bit more about that? That will hopefully give a good insight into what they were thinking at the time and what they were experiencing as well. There are obviously less helpful questions to ask as well. Yes, no questions won't really get you very far when it comes to the conversation. Questions like, um, did you find the doctor to be helpful? That's a yes no question. It's also quite a leading question as well. You're kind of saying to them, the implication is that they would find the doctor to be helpful, or did you find the doctor to be unhelpful? Is also a leading question. Whereas a more open question would be something like, "Can you tell me about your experience with the medics in that situation?" You also don't want to change the subject too quickly. If you find yourself, if you find yourself as you're having a conversation with the patient, if you find yourself not really listening to what they say, but kind of waiting for your chance to talk because you've had a thought in your head, that's a sign that you're maybe changing the subject too quickly. You can keep that thought in your head and you can say, right, I'm going to remember that and I'm going to come back to that avenue again once we've finished exploring this avenue that we're talking about at the moment. It's important also that you show emotional safety and respect. Some topics may be sensitive. Those can be topics about relationships. Those can be topics about the patient's belief systems. Those can be topics about lots of different things. What I want you to do is to be able to listen to the patient and to realize whenever there may be an area that the patient doesn't want to talk about, and not go down that line. The patient can also decline any questions, so the patient doesn't have to answer every question, and that's fine. They're here offering you their time and their insight, and so they don't have to answer anything, and that's okay. You can also pause. You can slow down. So it's okay to say, can we pause for a minute? Can we, maybe have a bathroom break? Patients might need to have a bathroom break as well. That's okay. It's okay to pause that and then to come back. Um, you know, uh, you can offer to go and get the patient a glass of water or something as well if you want. It's also okay to have silence. So it's also okay for you to stop and to pause and to say, I don't really know where to go now or what to say. Can you just give me a little minute to think about it? That's okay, and that's fine. It's also okay if you're asked a question and the patient is thinking, they're going to answer, and it's an appropriate question, but they're thinking about what to answer. It's okay to let that silence go on until they can formulate their answer. You don't have to jump in with another thing to ask or another or give them a suggestion. It's okay to let that silence sit. What are we trying to get you to learn in this session? A few things. We're trying to get you to be able to kind of sit with the uncertainty of what a real medical journey is like. Doctors, healthcare professionals very often do think in a very biomedical model where we want illness, treatment, illness followed by treatment, followed by outcome, and that's the end of the story. It doesn't really work like that in real life. What you to try to listen without trying to fix. You're there to get from the patient an understanding of their story. They're not there to get fixed by you. Wanting to get an appreciation of how an illness affects somebody in their life, a whole bunch of different areas, how it affects their sense of who they are, how it affects their roles in their family, in their work, in other important areas of their life. For you to really understand what it's like to live with a health diagnosis and a health issue. You can also hopefully understand why some patients struggle with care, even when the care itself is good. If a patient has been upset with their care, if a patient has found care very difficult, that's okay. It's okay that the patient feels like that. It may be that the care was as good as can be offered, but it's still not met the patient's needs. And again, that's a situation that can arise, and that's okay as well. It's okay for the patient to feel like that. It doesn't have to be resolved. I'm going to get you to do some pre-class reading. So the book that this idea comes from is this book called Narrative Medicine. I want you to read the first part of this book. This is a book that came out in 1996, and it was really the first book that looked at understanding patient stories in this way. The first part of the book is very interesting. It's a good way to get into the kind of experience that you're going to be having and to understand really what the process is and how it should work. You'll also see on Moodle for week 3, there's some pre-class activities for you to do. So you've got the PowerPoint from this session. You'll also have the recording there as well. You've got the Narrative Medicine book. You've got the link to it there. As it says, read part 1. And then you've also got this preparation task. So this is a task to help you to prepare to meet the patient. Now what this does is it takes you through a little bit of reading to do, which again is the part 1 of the book. Some questions to think when you're actually reading it, and then a bit of reflection for you to do. You can write this down, you can not. It's entirely up to you. Thinking about, do you feel anxious? Do you feel unsure when talking to patients in all kinds of circumstances? What do you worry about when you're thinking about that? Are you somebody who maybe likes to talk rather than to listen to the patient? Is that maybe part of what's going on? Thinking about what's your own internal experience before you actually go into this session. And the next thing is to go in and have some questions ready. Now, like I said, these questions don't have to be ones that you're stuck with. It's just so you go in and you've got something to hand to ask once that's the time to ask. Some examples. What's been the hardest part of this journey? What do you wish healthcare professionals understood better? Can you tell me what this experience has been like for you? Things like that. Yep, so it's a little bit of preparation for you to do, looking at making sure that you are ready. Last thing to do in this is to kind of complete this following sentence. When I meet the patient, I want to practice listening for. And now it's up to you what you want to be listening for. Obviously, you'll be listening to the whole patient story, but from your own experience in medicine so far, you might find that there are questions that you have about the way that healthcare works, and you've wondered things about what it's like to be a patient in A, B, or C situation. There might be things that you want to be listening out for. You maybe in your own imagination, you've thought, I wonder how I would feel in that situation with that particular problem. I wonder how that would affect me, how it would affect my own mental health, how it would affect my family, how it would affect my sense of who I am. Maybe that you've actually been through a health journey yourself, and this has been part of your experience and understanding. So you might think, I want to find out what that's like, what those parts of my journey. I want to find out what they're like for someone else. So have a little bit of a think of that. So you're going in prepared, really, really ready to see the patient. Okay, so have a go for that, and I will see you all on Monday.